Joe Swinson.
Thank you very much, Madam Deputy Speaker, and I'm delighted to be able to introduce this debate this evening on allergy services. Allergy comes in many varied forms and guises. It can be mild or severe, it can affect one organ only, or several parts of the body. Its severity can vary over time. There can be a single allergic cause, or there can be several. By their nature, allergies are complex. We certainly need to carry out further research into how they work in order to improve the way we treat and even prevent allergy and bring better quality of life to allergy sufferers. At this point, I feel I should declare an interest, having suffered from allergies myself since a very young age, and indeed recently completing the Loch Ness Marathon in aid of the charity The Anaphylaxis Campaign. I have a severe reaction if I eat any nuts, which results in the onset of anaphylaxis and an emergency trip to hospital. The excellent work of charities like the Anaphylaxis Campaign and Allergy UK in raising awareness of allergies and providing support to sufferers should certainly be commended. The first myth to dispel is that allergies are a niche issue. Recent research consistently shows huge increases in both the amount and seriousness of allergies occurring in society. In this House, many members have experience of allergies either personally or within their families, and indeed recently I was delighted to be a founding officer of the all-party parliamentary group on allergies, along with the honourable members for Dagenham and also Eccles. In truth, Madam Deputy Speaker, this is an area of urgent concern, an issue of major proportions and a matter that the Royal College of Physicians has seen fit to label an epidemic. Against this backdrop of growing seriousness, I want to use this timely debate to ask why there's a lack of urgency from the government to tackle what is, in terms of our future health needs in this country, a sleeping giant. Rates of allergy in this country are among the highest in the world. An estimated 30% of the population have an allergic disease. That's 18 million people. Among children, this figure rises to 40%. And in any 1 year, 12 million people, that's 1/5 of the population, will seek treatment for allergy. All the evidence indicates that the amount and seriousness of allergies is increasing rapidly. The Royal College of Physicians has estimated that there's been a threefold rise in incidence of allergy in the last 20 years. Severe and life-threatening allergies are now more common, with increasing numbers of children affected in particular. Peanut allergies, previously rare, now affect 1 in 70 children. Latex allergies now affect 8% of healthcare workers, whereas prior to 1979, only 2 cases had even been reported. Hospital admissions for anaphylaxis have increased 7-fold in the last decade. The financial cost of allergy to the health service and the economy as a whole cannot be ignored. Over 12.7 million working days are lost each year as a result of asthma alone, and ASTH the UK have placed the total annual cost of asthma to the economy at 2.3 billion. Adverse drug reactions account for 5% of all hospital admissions. 15% of inpatients have a hospital stay prolonged as a result of a drug allergy. Allergic disease accounts for 6% of GP consultations and 10% of the GP prescribing budget. The cost of allergy to the NHS has been estimated at 1 billion. Madam Deputy Speaker, figures can be persuasive, but it's often people's individual experiences that make the most compelling case. This quote comes from one serious allergy sufferer. "My quality of life is non-existent. I know this may sound extreme to a lot of people, but I would be prepared to lose an arm and a leg if it meant my asthma would go away. I face daily restrictions in every aspect of my life. I don't have enough breath to push a trolley around the supermarket. I'm not allowed on an aeroplane, and it's impossible for me to get travel insurance. Winter is also a problem for me. I can't go outside because the cold air can set off my asthma." A couple of constituents have come to see me suffering the problem of latex allergy. Eleanor McKendry had previously worked in the NHS when she then developed a latex allergy, and so she is no longer able to work in her trained employment. She even finds attending outpatient appointments as a patient is a challenge due to the lack of provision of latex-free environments even within our hospitals and healthcare services. Leslie Shannon, another constituent, faces a daily game of Russian roulette even when she goes to do her grocery shopping. Often she's found that supermarkets have latex balloons advertising in-store promotions which can trigger a life-threatening reaction even if she is anywhere near them. And I know from personal experience how terrifying an anaphylactic reaction is. The symptoms develop very quickly, within minutes of exposure to the allergen. For me, I have an unpleasant tingling sensation in my mouth and throat, which is soon replaced by swelling, breathing becoming incredibly difficult. At the same time, my forehead and my palms start to sweat, feeling clammy, and I come over all feverish. My heart rate speeds up. That prompts a feeling of panic, which isn't helped by the fact that I'm also finding it very difficult to draw breath. That's a terrifying enough experience for me. As an adult who has experienced it before, who understands my condition, I know what I have to do, get to hospital where I will be treated successfully, and I also have the knowledge that I carry an emergency dose of adrenaline in my handbag should I need to take that en route to the hospital. So how much worse must it be for a parent of a baby or a young toddler who can't even explain their symptoms and who goes from being perfectly okay 1 minute to life-threateningly ill within just a short space of time? This is what people are actually facing in terms of allergy. And there are many, many difficulties. First of all, the range of allergens is so broad. Common food allergens include nuts, fish, seeds, milk, kiwi fruit, but there's many, many others too. Then there's chemicals, latex, dust, pollen, house mites, grass, the list goes on. Identifying the allergen itself can be difficult, and then avoiding it is sometimes impossible. I've given the example of Eleanor trying to avoid latex in health centres and Leslie trying to avoid it in shops. With a nut allergy, I can assure you that ensuring I don't eat any nuts is no easy task. Companies do seem to be more aware of their responsibilities, but rather than providing helpful information, more often there's just a generic statement that the product may contain traces of nuts. I challenge you to look next time you do your shopping at the back of packets and you'll see just how many products carry this kind of warning. Even here in the house catering outlets, a legal disclaimer is visible at the bottom of every menu stating that nothing can be absolutely guaranteed to be nut-free. Where am I supposed to eat, I wonder? There's many issues surrounding allergy which must be addressed, and I hope the all-party parliamentary group will be doing so over the coming months, not just with the Department of Health, but also, for example, those in charge of housing, the environment and business regulation. But in this debate, I'd like to focus specifically on what the right course of action is for the Department of Health to take to tackle this growing and potentially fatal condition. There are 4 key reports from recent years that inform this allergy debate. The first, produced by the Royal College of Physicians in 2003, puts into stark relief just how urgent the allergy epidemic has become. Worryingly, it states that for allergy patients, the health services, and I quote, failing to meet the most minimal standards of care. It paints a picture of a service in which GPs deal with the majority of allergy cases, despite having no clinical training in allergy, and in which patients are referred to a different succession of specialists, resulting in confusion and inadequate treatment. The overriding criticism the report makes is of the shortage of specialist allergy expertise. There are just 6 fully staffed allergy clinics in the whole of the UK, unequally distributed with a strong southeastern bias, and there's a major shortage of specialists with expert knowledge on allergy. If it's reckoned that there's 1 consultant in a mainstream medical speciality per 100,000 members of the population, the equivalent figure for consultant allergists is 1 per 2 million members of the population. The report's recommendations are clear. Create more consultant posts and funded training posts in allergy to form the basis of a genuinely national allergy service for the NHS. Set up regional allergy centres with appropriate staffing levels and ensure even distribution across the whole country by locating at least one of these in each of the NHS regions. The second report, which I would refer to, was the 2004 Commons Health Select Committee report, and it mirrored many of the points raised in the Royal College of Physicians report. It too identifies a lack of training and expertise in allergy amongst health professionals in primary care. It also finds the level of allergy expertise at consultant level is inadequate, and it calls the distribution of just 6 allergy centres manifestly inequitable. The Select Committee supports the College's proposal for a specialist allergy centre in each former NHS region, with a minimum of 2 adult and 2 paediatric allergy consultants. And long term, it argued that allergy should have a full specialist consultant workforce, as is the case in many other countries, with an extra 10 training posts introduced year on year. The government's response to the committee report pledged a review of allergy data and demand for treatment. Disappointingly, however, the response failed to address directly any of the recommendations made by the committee on GP training, consultant numbers and specialist allergy centres. And I'm hoping that perhaps today the Minister will be able to respond to those points raised by the Commons Health Select Committee report. In 2006, the Department of Health published its own review, which it said it would do in its response to the Health Select Committee report. But again, those hoping to see the recommendations of the Health Committee report acted upon were left wanting. despite conceding that people with allergies often feel let down by the poor service they receive, finding that some people can wait 3 to 9 months for an appointment to see a consultant, and even stating that a significant number of deaths could potentially be prevented with an improved service, the review's recommendations fall short of what was hoped for. It finds that incomplete research makes it difficult to establish compelling evidence of the need and quality of allergy services and raises problems in drawing up a strategic national view of how services should be developed. We're told that the department will ask local health commissioners to establish levels of need for allergy services and allow strategic health authority workforce planners to explore scope for additional training places. They'll also ask for development of NICE guidelines on allergy to be considered. I hope, given that response was in 2006, the Minister will take this opportunity to update the House on what action has been taken to act on these recommendations. And the last report I want to refer to is the Science and Technology Committee report from the House of Lords, which was published in September this year. Again, it's quite familiar findings. The report has recommendations that echo what the Royal College and the Commons Health Committee said in their reports in previous years, particularly on the need for specialist allergy clinics and improved GP training. Fortunately, helpfully timed for this debate, the Government's response to that report was published earlier this week. That response reinforces the Department's determination to devolve decision-making on allergy care and avoid developing a strategic overview of allergy services. It states that local need is what will determine how allergy services should be provided, placing the responsibility for allergy services squarely in the lap of primary care trusts. On GP training, the response notes that no allergy-related guidance topics have been included in the NICE work programme yet. It states that the Department of Health is not responsible for setting curricula for health professional training, but clearly the Minister knows that she can, however, bring her influence to bear here. And I would like to know, what does she intend to do to ensure that our GPs receive the training that they clearly need to be able to diagnose and treat allergies swiftly and effectively, particularly with increasing numbers of people coming through their doors who will need that expertise? Madam Deputy Speaker, I have set out the evidence that makes it clear beyond doubt that we are facing an allergy epidemic. There are increased numbers of allergy sufferers, increased severity of allergies, and particularly pronounced evidence among children. These are all symptoms of the problem that we face. I've set out the recommendations of the Royal College of Physicians as well as the committee reports of both houses. These centre on the need to increase consultant numbers, the need to increase the provision and geographical equity of specialist allergy clinics, and the need to improve the training of GPs in allergy diagnosis and treatment. I've also covered the Government's reaction to the problem, both through its responses to the Select Committee reports and through its own review published last year. These amount to an admission that there's a problem, as well as a commitment to assess how to deal with it. But unfortunately, I fear little more than that. So, in conclusion, I would just like to ask the Minister to address some further questions in her remarks. Does she agree that there is a considerable gap between the necessary measures recommended by independent reports into allergy services and the steps that her department has so far proposed to take? How seriously does she take the allergy epidemic that we face? Remember that we're talking about a problem affecting 18 million people in the country. And does she think enough is so far being done about it? And finally, does she really think that local primary care trusts are best placed to combat the allergy epidemic? We all understand the notion that solutions are best delivered in response to local needs, and we want our local healthcare services to be accountable locally. But given the constraints faced by PCTs in terms of budgets and centrally driven targets, and the lack of strategic central guidance on allergy, I fear there will be little incentive for them to make tackling allergy their prime concern. I look forward to the Minister's comments.